I talked to one of South Florida's premier plastic surgeons, Dr. Gregory Albert. And in an interview taped earlier, I asked Dr. Albert what new innovations has been launched in his practice.
Yeah, the latest aspect that we're doing is we're doing virtual consults. So we're utilizing the internet to talk to patients at the beginning stages of their consultation to find out what they're looking to improve. And then also, we're actually using it to follow up with patients. So when I have patients that fly in or drive from long distances and they have a, what might seem like a minor question or sometimes a major question, now with smartphones and devices like that, they can take a picture, they send it to my office, and then I can give them the instantaneous answer. So they can put them at ease and reassure them, or tell them, this is something we need to be concerned about, and bring them in right then and there.
You're stepping up. You're in the 21st century in communications, Doc. Not only that, but hey, with the plastic surgery thing, you got a new innovation where you can do it without invasive stuff. What's that all about?
Right. So recently, we've had a big swing towards doing less invasive procedures, namely Botox and injectables to augment the face. Right. And those procedures have really become popular. And being a plastic surgeon, I do injectables and also surgery.
Right.
So nowadays, people, they want to start sometimes with small things, and once they see what kind of results they can get from injectables, then they'll step into possibly more invasive things like surgery that injectables or non-invasive things can't do.
Well, speaking of surgery, can you get rid of the turkey thing that I have when you get older? Can you handle that, Doc?
That is one of the most popular procedures in men. And they say that to feel more confident, they don't like the fact that it hangs on their shirt.
Yeah, that's right.
And they feel stronger at work when their neckline is more
streamlined. Right? Yeah, that's what.
Right.
Well, when you you're one of the top plastic surgeons in South Florida, and with all your new systems that you're setting up there, how's business doing for you right now?
Business is good. It's kind of evolving. Over the last few years, since the economy kind of turned around, patients are doing smaller procedures. Right. And then working their way up to bigger ones. So if someone came in before and wanted to have a facelift and have their upper and lower eyes done, they may. I've seen a lot of patients doing, let's start with my eyes first. Right. Or they'll say, let's start with the face, and then when we'll do the other things. Or they'll come in and they'll say, I want to do some injectables, and when I have, the time and funds, I'll go and do the surgery.
Taking a step back, talking about men, and plastic surgery has long been a domain of females, right? And are you seeing more males getting involved in plastic surgery now?
Well, the great thing is that men are becoming more comfortable with the idea of plastic surgery. And they're realizing that, hey, when I look in the mirror, I want to look like I did 10, 15 years ago. And they're becoming more comfortable. So yes, more women are still coming for the plastic surgery, but the men are becoming more comfortable. And I think the openness of people nowadays to accept plastic surgery, they say, hey, what's wrong with wanting to look your best? Because then you'll feel better.
The stigma's all gone. I know guys say, Jesus, you look great. And say, I had some work done. And they're very upfront about the whole thing. I think that's super.
Right.
Well, speaking of men, you're the official plastic surgeon of the Florida Panthers hockey team, and if anybody needs plastic surgery, it's hockey players. How's that going with you?
It's been great, and especially this year, we're going to make the playoffs.
Hopefully.
And, hopefully, right. I'm basically getting the players back into the game. They have longer careers. They're getting, they have injuries, broken faces, broken noses. And I'm at the games putting them back together so they can get back on the ice. Kind of like I'm doing in the office, too, getting back into the game.
Oh, that's great, Doc. Well, listen, I want you to thanks a lot for being here, and welcome back, by the way. He used to be on the Business Show giving some vital information on plastic surgery and general health situations. Anyway, one more thing before we wrap it up. You know, we're in South Florida, we're in the sun. Everybody likes to go out in the sun, and the doctors always say, stay out of the sun. What's your outlook on that?
Right. We can't stay out of the sun. I mean, the sun's there.
Yeah.
You need to wear sunblock, and you need to try to avoid, if you're going to be outside, try to avoid being out between the hottest parts of the day or when the sun's the strongest, between, about 11 and 2. But sunblock in the morning, I mean, every day, even if it's 10 minutes, sunblock of 30 or more.
Okay.
And then if you're out for more than a couple hours, you need to reapply.
Okay, great.
And then there's always the shade.
Yeah, all right. Well, listen, thanks a lot, Doc, for being here, and welcome back again. God bless you.
Thank you.
All righty. And stay with us. We'll return right after these words.